Hello, I'm Roberta Lavin, and I am your professor for this course. This is Chapter 2, Concepts and Definitions in Nursing Research and Evidence-Based Practice. This chapter only has 3 learning objectives: to define the terms identified in the chapter, to apply those terms in the chapter to nursing research, and to explain how and why some terms may be used differently in quantitative and qualitative research. Learning the language of research and evidence-based practice is a necessary first step in research. Without first learning some essential language, it is difficult to read a nursing research textbook or research literature that is littered with technical terms and jargon, and often even abstract terms. Some terms are ubiquitous to the discussion of research, and we will begin with those terms. The first is variable. A variable is a property, characteristic, number, or quantity that can be counted or measured. It can be related to a person, setting, or an event. Variables are concepts or constructs, meaning that they tend to be broad topics of study. Concepts are the abstract ideas or phenomenon that are being studied. And constructs are ideas that were developed for specific theory or a specific problem and contains various conceptual elements that are not considered empirically validated. Caring is considered a construct in nursing. It is a very broad term that has historically been the focus of study. To researchers studying caring, we must be able to both define what caring is and measure caring. What is used to measure caring, listening to patients, sitting with patients, is then considered a variable. So, let's review this one more time. The variable is what we're measuring. It's either something that we're doing and then something we're measuring. So, sitting and listening to the patient would be a variable. A construct, then, is the thing that we're trying to influence, which is, or to study, which is how does caring impact the outcomes of the patient, or even the satisfaction of the patient, or the happiness of the patient. Sometimes it's easier to see concepts to understand them. So I'm presenting here a graphic representation of how all the types of variables fit together. Categorical variables can be divided into 2 or more categories. So we start out with categorical variables and numerical variables. Categorical variables tend to be qualitative. Numerical variables tend to be quantitative. Variables are either categorical or numerical. They're one or they're the other. Categorical variables are grouped by either characteristics or quantities. When thinking of categorical variables, they should include all possibilities of groups, and those groups should be mutually exclusive. The most common categorical variables in nursing research is genetic gender. A person is either male or female genetically. If we think about lung cancer, then smoking, if we answer, do you smoke? The answer is yes or no. That's a categorical variable. However, if we ask the number of cigarettes smoked, then it's a numerical variable. Now keep in mind, I had this friend some time ago that had lung cancer, and when he went in and he saw the doctor and he was diagnosed, the doctor asked him, "Do you smoke?" And he said, "No, I quit." And they said, "When did you quit?" And he said, "Just now." You have to be careful about how you ask a question. Categorical variables can be further described as either ordinal or nominal. Ordinal variables can be ranked as higher or lower, but do not measure the difference between the objects. For example, a high school education is higher than an elementary education and lower than a college education. Another example is a grade in a class, A, B, C, D, F. Nominal variables are those that cannot be arranged in a logical sequence. For example, eye color or religious preference. Numerical variables describe a measure of quantity or a measurable quantity. For example, 10 minutes or 10 pounds. These measures are quantitative. Numeric variables can be either continuous or discrete. Continuous variables are any real number that can be measured by the instrument you're using. For example, weight can be measured in pounds or kilograms on a normal bathroom scale, but scales measuring grams or fractions of grams are used in premature infants. A discrete variable, however, can only measure a whole number, 2 children or 10 pediatric clinics. You can't have half of a child. So this is one way to visualize it and to think about how these different types of measures fit together. Can you name some other categorical variables used in research? What are some forms of data that you collect in nursing care that has distinct categories that are mutually exclusive? Think about this. Try to answer the question. Variables need a little more discussion. It is critically important for you to understand the difference between independent and dependent variables. In quantitative studies, concepts are called variables. Variables are measured. If something can be classified into 2 or more categories, it is a kind of variable. Variables vary, thus the name. For example, if you study lung cancer, then smoking could be a variable. How many children I have may be a variable that gives quantitative information. But my blood type is also a variable, but it only gives categorical information. Now, let's talk about dependent and independent variables. This is important for you to understand and remember. We just talked about smoking and lung cancer. If we ask the question, does smoking cause lung cancer, then smoking is the independent variable because it is presumed to affect the dependent variable, which is lung cancer. Kerlinger defined it this way: an independent variable is a variable that is presumed to influence another variable called the dependent variable. Correlation and causation, one of my favorite topics. Relation or correlation is the way 2 or more variables, concepts, objects, are connected and what they have in common. The relation between 2 variables is often thought of as cause and effect. How does one affect the other? Relations can be positive, stress level and blood pressure, or simple carbohydrate intake and blood glucose. As one increases, the other increases. If a person eats more simple carbohydrates, the blood glucose will rise. there is a positive correlation between the two variables. However, the connection does not always mean causation. If I wanted to study how to reduce the risk of lung cancer in smokers, I might notice that the person with lung cancer are more likely to smoke and more likely to have ashtrays in their homes. I can show that there is a correlation between having an ashtray in the home and the incidence of lung cancer. Though there is a relation between the two variables, the ashtray does not cause the cancer. Positive relations or positive correlations are not always causative. So remember, correlation describes the size and direction of a relationship between two or more variables. Causation indicates that one event is the result of the occurrence of the other event. I provided you another graphic which is interesting, and there was this belief that at many, hundreds of years ago, that bad smells caused disease. Well, it was the germs that caused the bad smells and the germs that caused the disease. But when there was the bad smell, there was sometimes disease. So, correlation does not always equal causation. Stop and ask yourself, why do we care about measures? What do measures actually do for us? Nursing clinical research is interested in outcome measures. A measure is the quantitative estimate of the property or characteristics that is of interest. An outcome measure assesses the patient's current status. For example, Reese et al. In 2022 showed the effectiveness of ivermectin among patients with COVID. Their outcomes measures were hospitalizations due to COVID within 28 days and an emergency department visit to clinical worsening within 28 days. The collection of such outcome measures allowed the researchers to assess the impact of the intervention on the outcome. The intervention was ivermectin, and the outcome was hospitalizations or ER visits. Of course, there are also many studies that show that it was not effective. The question is, how do you eventually look at the studies and decide what's a good study and what's not a good study? We'll discuss that more as the semester goes on. Measures must be changed to numbers to make them useful in statistical analysis. Once you change a measure such as hospitalization into a 1 for hospitalized or a 0 for not hospitalized, it's possible to study the data. Data measurement scales assign numbers to an attribute or a characteristic. There are 4 data measurement scales: nominal, ordinal, interval, and ratio. Let's begin by reviewing the level of measurement. Nominal measurement is categorical data, and it uses numbers but only as attributes, such as a male is 1 and a female is 2. Ordinal measurements rank an attribute. 1 would be they completely agree, 2 they partially agree, 3 they don't agree at all. Interval measurement is about rank, and it provides a distance between attributes. Scores on an assessment exam would be an example. Ratio measurement is something that has an absolute meaningful 0 and provides information that about the absolute magnitude of the attribute, such as height and weight. Variables in interval and ratio data are often called continuous variables. Now that we've reviewed the different types of variables, I want to provide you this table, which you can also find in your textbook. The table is useful because it shows you a basic description of nominal, ordinal, interval, and ratio, but it also gives you some examples that will help you to understand it for hopefully better. So, examples of nominal would be nationality, eye color, and gender. Ordinal would be any Likert scale. Um, High school, undergraduate, graduate, or the stage of cancer. When we see cancer stage, that's an ordinal scale. The data is ordered. Interval, it is ordered and of equal distance between intervals, but there's no absolute zero. So a good example of that is IQ test, age measured in years, temperature when we're measuring it in patients. And then ratio, there is an absolute zero. So height, weight, and measuring temperature on the Kelvin scale, there is an absolute zero. Here's a question for you. If you gather data on the state a person was born, what kind of variable is it? Why don't you take a little time, go back to the table, and see if you can answer this question. When most people refer to variance, they mean different or inconsistent. When a researcher refers to variance, they mean a measure that expresses the variability and indicates how far a set of measures are spread out from the mean. In nursing, this is particularly important in quality management. It allows those responsible for quality assurance in healthcare to recognize what is naturally occurring variability and what is expected or unexpected. For example, what variable in nurses' work schedules may impact a variance in medication errors? So again, variance is a measure that expresses the variability and indicates how far a set of measures are spread out from the mean. Let's talk a little bit about probability. The lack of certainty can lead to misunderstandings by those who lack research training and is worsened by those that intentionally misrepresent or intentionally misinterpret findings for political, religious, or other motives. We all see this happen. It happens more often now than I believe it ever has in the past. Nursing research doesn't offer certainty. It does offer probabilistic knowledge. For example, if nurse work hours are reduced, then medication errors are reduced. This is what we think will probably occur. This would be stated as nurse work hours reduction probably leads to medication error reduction. Probability is the ratio of the number of outcomes in an exhaustive set of equally likely outcomes that produces a given event to the total number of possible outcomes. Probability is represented as a number between 0 and 1, as you can see in the graphic. Another example of when probability is used is in life insurance. Insurance companies use probability to predict life expectancy and base insurance rates on that probability. For your purposes, you need to understand that probability is never certainty. When reading probabilistic statistics in research articles, this chart will provide you with a helpful way to interpret them of 0 to 1, with 0 being very unlikely and 1 being very likely. And you can see the divisions of when this occurs. We ideally want things to know if they're likely or very likely or unlikely or very unlikely. It gives us an idea of what we're seeing and how to interpret it. To give you an example of insurance actuaries that predict life expectancy, I have these friends who are sisters who run a convent, and their population is aging because they're not getting new members and they're getting older. And they needed to think about how they were going to manage as they essentially died off. So they went to the people that do insurance actuarials and asked them to prevent their rate of decline. In other words, how much their numbers reduced each year until there were none of them left. And they gave them an estimate, and they did it by years, going out 20 years. And they told me that at the time they handed it to them, they all said, "This cannot be possible. This is surely not, we're not going to die off at this rate." And they said every year they look back at it and say, yeah, they were spot on. So probability statistics are useful, and we will also discuss them more later in the semester. When a nurse researcher is planning a study, the research design is the plan, structure, and strategy of investigation for answering the research question. It is standard practice to identify a theoretical or a conceptual framework on which to base the research. A conceptual framework provides a structured system for organizing thoughts, perceptions, and expectations about events and processes for the purpose of enhancing observation and interpreting phenomenon. A theoretical framework should come from and be based on the published literature. A theoretical framework is an element of a conceptual framework that situates the relationship explored in the study into the context of developing or testing formal theories. Thus, the theoretical framework tends to be supported by prior research and scholarly publications, and is more focused than the conceptual framework. One way to think of frameworks and paradigms is a map of a clinical unit. So think of it this way. When you first go to work in a new hospital, you need to know where everything is on the unit. You know that with the number of patients you have, you don't have time to be looking for things or trying to find your way around. So a map is helpful that points out some of the important things. Where are the medications stored? Where are rooms with different kinds of supplies? How do you get down to X, Y, or Z? You need that on the map, right? But you could make a map that was so detailed that you couldn't fold it up and put it in your pocket. You would need a whole book to carry around to show all the elements of everything in the hospital on a map. Consequently, it's kind of like conceptual frameworks and theoretical frameworks. You need enough detail that you can find what you need to find without so much detail that it becomes not usable to you or not practical. Remember, practicality matters. Well, we have finished chapter 2, and hopefully you have some of the terminology that you need to think like a scientist. As always, I have office hours twice a week. I hope you will join me. You can ask any questions during those office hours related to the chapter or the assignments, and get input on papers and other activities you need to successfully complete the course. Thank you.